My name is Elliott Stieglitz, and I'm a pediatric oncologist at the University of California, San Francisco, Benioff Children's Hospital. I am truly excited to share this video today, as I will discuss a clinical trial that is the fruit of nearly a decade of work. I also want to start by thanking the Pediatric Cancer Research Foundation, without whom this work would not be possible. This is actually the second time I've received a grant from the PCRF, and I'm incredibly appreciative of the past and ongoing support I've received from this organization. The disease that I treat and study is called juvenile myelomonocytic leukemia, or JMML for short. It's the third most common type of leukemia in children, but it most commonly affects infants and toddlers. It's considered an aggressive type of blood cancer, and approximately half of children with this leukemia will be cured after a very intensive treatment called stem cell transplantation. Unfortunately, about half of patients will also have their leukemia come back or relapse even after a transplant. One of the most peculiar aspects of this disease is that there are rare patients around the world that have been known to go into a spontaneous remission, where their leukemia goes away, but does not require the intensive treatment like a stem cell transplant. Until now, there has never been a test that is reliably capable of informing doctors and parents whether their child or patient has the aggressive form of JMML and should go on to receive a stem cell transplant, or whether they can be observed with only moderate intensity therapy. The PCRF has previously funded work for us to validate a test that we developed in the laboratory that measures something called DNA methylation in blood cells that is capable of predicting just that, which patients should be observed with non-intensive therapies versus those that should be taken to transplant immediately. In our prior work funded by the PCRF, we collaborated with colleagues from Europe and Asia and tested samples from hundreds of JMML patients using our new assay and proved conclusively that DNA methylation is the most predictive test available in this disease. We are now ready to put this test in the clinic and offer it to patients in the context of a clinical trial for newly diagnosed patients with JMML. This will be funded by the PCRF and conducted through the Therapeutic Advances in Childhood Leukemia and Lymphoma Consortium, also called TACKLE. In this trial, patients with a low DNA methylation score will be assigned to receive non-intensive therapy for up to a year. But most importantly, for the first time in the context of a clinical trial anywhere in the world for JMML patients, these young infants and toddlers will not necessarily receive a stem cell transplant. In contrast, patients with a high DNA methylation score will receive a combination of medications that have previously been shown to be effective on their own, but never combined in children. These higher risk children will go on to receive a stem cell transplant, as it is the only known cure in this disease. This clinical trial is novel in a few different ways, including the concept of risk stratification, where patients will be assigned an intensity of therapy appropriate for their individual risk of relapse. We will also be combining medications that have been shown to be effective on their own, but never combined together. Again, I want to thank the PCRF for their willingness to support this type of high risk, high reward research. And I also want to thank all the families around the world who have participated in clinical studies and who have donated tissue to make this work possible. I look forward to sharing updates about this clinical trial as it enters the clinic. And once again, thank you.